Okay, we're connected. You may begin.
All right, good evening. I'm Richard Nobles and I serve as chair of the Licensed Psychology Advisory Committee, excuse me, of the Kansas Behavioral Sciences Regulatory Board. Today is Tuesday, the 9th of June, 2026, and I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Linda Heisman Powell. I do not see Linda. David Stevens,
Here.
Jennifer Fontaine. I,
There we go. Sorry, I apologize. I couldn't find the button. I'm here.
no problem. Daniel Garlock,
I'm here.
Matthew Gulker,
Present.
Jessica Hamilton,
I'm here.
Edward Hunter,
Present.
Tiffany Johnson,
Here.
Sarah Kirk won't be with us this evening, Christopher Leonard,
Here.
Jay Middleton,
Here.
and Robert Twillman will not be with us this evening either. I note the following staff members are also present: David Fye, Executive Director of the BSRB.
Here.
And Leslie Allen, Associate Director. Did she respond?
She is here. I think she is currently muted. So
Okay.
I'm here, sorry.
Oh, no problem. Thank you, Leslie. Next, David Fye will read a message concerning this meeting being held remotely.
thank you, Richard. This is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or the KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no time for public comment as no individuals requested time for public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On April 22nd, 2026, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meetings. The notice was also posted on the board's website at ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may contact the board office by sending an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I did check it before we got started. There's no one currently on the line, but if someone connects and introduces themselves, I will let you know. And I'm sorry, Richard, I think you are currently muted.
Yes, it would be helpful if I were not muted. The meeting is now called to order, and the advisory committee will begin its discussion of the first item of the agenda, and that is the approval of the agenda. Do I have a motion to approve the agenda?
Motion to approve the agenda.
I have Jay moving to approve the agenda. Do I have a second?
I'll second.
Chris Leonard, second. All those in favor, please do say so by saying aye.
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 All those opposed, same sign. The motion carries. So I'll move us along to our next agenda item, and that's the review and approval of the minutes from our last meeting. You all had an opportunity to read over the minutes, excuse me, previous to today, and I'll take a motion to approve the minutes from our last meeting.
I can motion.
Jessica moves to approve the minutes. Do I have a second?
Second.
Jay Middleton seconds. Any discussion with respect to the minutes from our last meeting? Seeing none, all those in favor of approving the minutes from our last meeting, please do say so by saying aye.
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 All those opposed, same sign. The motion carries and the minutes from last meeting are approved. And I'll now move us on to the executive director's report. Dave, please take it away.
Thank you, Richard. We'll go ahead and start with some updates from the most recent board meeting. That happened on Monday, May 11th, and at the full board meeting, the board had a special guest attendee. Our board meetings are usually in hybrid form, so some individuals are usually at the board office, some are remote. We had a guest in person at the office, and that was Dr. Marianne Bernetti Atwell. She is the CEO for the Association of State and Provincial Psychology Boards, ASPPB. Dr. Bernetti Atwell has been the CEO of ASPPB for the last few years, and one of her priorities that she has worked on the last about 3 years is that she really wants to reach out to every jurisdiction that regulates psychology, every state, every province, and she would like to connect with them. And if there's an opportunity to meet with the boards, she would like to go visit with them. And so we extended an invitation, and she came and had an opportunity to talk to several board members, give us a lot of good updates. And it was really great to kind of connect the board with one of the national associations. The composite board, we work with several different associations, but I thought it was really great to have her in Kansas, and we'll continue to work well with her. Also at the board meeting, there were a lot of updates from mid-year meetings. One of them we'll talk about a little bit later in this meeting, and that is the mid-year meeting from ASPPB. But at the board meeting for the BSRB, we talked a little bit about some of the updates from the social work mid-year meeting. And I just like to share those for some of you as well. I know it's a different profession, but I think it's helpful for all of you to kind of hear a little bit of high-level information for their professions, so you kind of can see what's going on in different professions that we also regulate. For social workers, they are launching a new version of their exam this year. It's actually coming out very quickly in August. And so their exam is going to be changing in certain ways. They have a change from 4 areas to 3. They're reducing the number of questions on their test. They are also increasing some flexibilities and shifting from 3-option multiple choice questions or 4-option multiple choice questions to 3. So there's some interesting things going on in terms of the testing format, but also the testing content. So that new version of their test is going to be released in August, like I said. There was also it's really an annual meeting, but it's for states that regulate behavior analysts. And I was able to attend that meeting with BSRB board member Linda Heitzman Powell, who is also a behavior analyst. We were able to ask a lot of different states some of the different ways in which they license behavior analysts and looking at trends in terms of licensure. And we were able to ask some questions as far as entry-level positions. For that profession, we have 2 levels of permanent licensure, but our assistant behavior analyst has not really seen a lot of growth over the last 10 years, while the master's level licensed behavior analyst, that number has really exploded from about 129 about 10 years ago to about 600 or so now. So, and we don't see any sign that that's going to be decreasing. So it's good to connect with individuals at the national level and try to reach more, uniformity and find out best practices from our peers. Another item that we discussed at the mid-year meeting or at the last board meeting that we'll kind of comment on a little bit later too is we have the upcoming mid-year meeting for SIPAC. So I'll let Richard give some updates on that when we get to that on the agenda for this meeting. But also from the board meeting, the board talked a little bit about its upcoming out-of-town annual meeting where the board moves around and holds an in-person only meeting. The board does this once a year. It's usually for a full day. Sometimes the board decides to start the day before and kind of combine the 2 days instead of doing an earlier board meeting that month. So that is what the board decided to do for the upcoming board meeting. It's going to be in September, and it's going to start on Sunday, September 27th. Usually, I think what we talked about right now is that it would start either about 5 o'clock or 5:30, and then it would go for about 2 hours in the evening. And then the next day it would be an all-day meeting from about 9 in the morning until about 4 o'clock in the afternoon. And one of the items the board is going to be working on is the strategic plan for the BSRB, kind of outlining a multi-year plan to look at different things the board can improve upon, and also making sure that we have a good idea of some of the things that are working well, and making sure that we can continue to do those things at the same level of quality, if not better. So really excited about an opportunity to work with the board on some of those topics. Again, that meeting is going to be an in-person only meeting. It is open to the public. We will put that information on the BSRB website once we have the contract secured for the location, but it will be in Leavenworth this year. The last few years, we have held that meeting in Overland Park, Wichita, Lawrence, Manhattan, and so now it's going to be in Leavenworth. And if anyone is in the area, they're welcome to attend. Additionally, another item that they discussed at the upcoming board meeting is the election for a BSRB board leadership. Every year, in the first meeting after the start of the fiscal year, the board elects a chair and a vice chair. The current board chair is Dave Anderson, and the current vice chair is Laura Shaughnessy. And Dave Anderson has served in this role for 2 years, and he has basically announced that he is going to be stepping out of that role. And so there will be a change in leadership for the BSRB. So really excited about that upcoming election at the July board meeting. And so that'll be taking place. The next board meeting is going to be on July 20th. And so that's one of the items for the agenda at the next meeting. There were some reappointments of advisory committee members at the board meeting as well. For the Licensed Psychology Advisory Committee, there was one member who was up for reappointment, and that was Christopher Leonard, and he has been reappointed. So congratulations, Dr. Leonard. Appreciate you serving on the advisory committee, and looking forward to serving with you for another couple of years, for sure, at least. And so for all of you who are in the middle of a term, when your 2-year term ends at the end of next year, as long as you're not reaching your maximum length of service, I will reach out to you to see if you are interested in seeking reappointment. And then if you are interested in continuing on with the advisory committee, I will forward your name to the chair of the board for consideration to see if there's any questions. And then you will likely be added to the board's agenda for reappointment at that time. So, but congratulations to Dr. Leonard for his reappointment. And I think that's the last update from that previous board meeting. Like I said, the board usually is going to meet the second Monday of the month, every other month. So the normal board meeting would have been Monday, July 13th, but that is going to be the day of the SIPAC mid-year meeting. So to allow Dr. Nobles to be able to serve as the commissioner for Kansas and attend that SIPAC mid-year meeting, the board decided to move their meeting 1 week later to allow him to attend the mid-year meeting for SIPAC and then have the full board meeting the week that follows. Moving to just a few updates as far as BSRB operations. It's a very busy time in the office. We've had a number of recent graduates, and when people graduate, they tend to submit applications all at once to the BSRB. So we've been processing those as quickly as possible. Also, a lot of individuals are getting approval to take their examinations, and a lot of people not only are graduating, but they're passing their exams and they're getting licensed. So we're quickly trying to review everything that we have access to. Once those transcripts are posted, we'll be able to move more people through the process as well. So congratulations to all the recent graduates and also those who are becoming licensed. Really looking forward to helping more people join the profession, and I just want to send a congratulations that way. In terms of one other item, I just want to make you aware of, in combination with some of our updates from ASPPB, having Dr. Marianne Bernetti Atwell at the BSRB office. She provided a number of updates to the board as far as some resources that are available. And I know sometimes we give general updates as far as ASPPB, but to kind of conclude my report, I did just kind of want to give you all a request or a recommendation in terms of a homework assignment. The website for ASPPB is a really good resource for us. And I think some of you would benefit from some of the information they have posted as well. You'll see in your packet of material for the meeting, one of the articles has to do with AI, and that was from the ASPPB website. So what I would encourage you all to do between this meeting and the next meeting is just go visit the ASPPB website, take a look at maybe the news information or information on the upcoming launch of the new version of the EPPP, or any information that is there for licensure or other tools. I think that when they highlighted a lot of their different resources in the announcement, it brought a lot of things to mind. And so I definitely wanted to make sure that you were all aware of those tools and that information as well. So their website is aspppb.net. So a real simple website, but I would encourage you to take a look at that between this meeting and the next meeting. And then perhaps the next meeting, if there's anything that caught your eye, you might be able to share that with the advisory committee, so we can kind of learn from each other and continue to use more of these resources that are available. So their website again is aspppb.net. And with that, I'll conclude my report and see if there's any questions on any topics I discussed or anything else.
I just want to say how enjoyable it was to have Marianne at the meeting last month, and I think that she brought forward a wealth of information, and I really appreciate her coming out here. And I would encourage members, if you have any free time, and I know that that can be scarce, but if you do have any free time, to go back to the board meeting from last month to watch maybe a bit of what was done at the BSRB meeting in May. Any other questions or comments or anything that you might want to ask Dave about from his executive director's report? All right, well, seeing none, I'll move us on to the next agenda item, and that is updates on ASPPB. Dave, please take it away.
All right, thank you, Richard. The first update is we've talked a little bit about the upcoming launch of the new version of the licensing examination for psychology, the EPPP. There is now sort of a term that is going to be used for the next couple of years that is called the integrated EPPP. And what that term will mean is it is basically the new launch of the licensing examination. When that launches, it will be a combination of items from the current version of the licensing examination that it has been referred to by some individuals as a knowledge-based exam. And then it will also include some components of the EPPP2, which has been described as a skills-based exam. And this was the result of a task force to come together and, as opposed to requiring two separate examinations, to really rethink and rework the licensing examination, valuing both components and putting together a cohesive examination. So ASPPB has been, in my opinion, very good about hosting town halls and putting forward information to share their plan and the different steps along the path in terms of launching this new version of the exam. I actually attended a town hall earlier today with a new version of the information as far as the launch of the exams. Just to let you know, the plan is still for the new version of the exam to launch, I believe, in the fourth quarter of 2027. There will also be a new handbook in terms of how to prepare for the examination that will be provided by ASPPB. There is going to be, earlier on in 2027, there will be a beta test exam, and that is going to be made available for individuals needing to take the licensing examination. The beta test will be in March to April of 2027. As it's a beta test exam, what they are recommending is that if individuals elect to take the beta test exam and they pass, they would recommend that licensing boards view that as a pass. If individuals take the beta test exam, ASPPB would recommend that it is not looked at as an attempt. And I know some states limit how many times someone can take the examination. They basically said, since it is beta testing, if someone passes, they would recommend that states recognize it as a pass. If they fail the beta test, they would recommend that states don't recognize it as a fail. You don't get credit for a pass either, but it shouldn't count towards the number of attempts you can take on the exam. And the cost for the beta test would only be about $100. They plan to collect that information, make the beta test scores available in June of 2027. As they launch the new version of the exam in the fourth quarter of 2027, what they have started to kind of walk through is they know some individuals are going to be taking the current version of the exam at the same time that, or maybe right before the launch of the new version of the exam. So what they have said is that if someone has taken the EPPP and has been unsuccessful, after the new test launches, there will still be a window of time where those individuals will be able to register for the EPPP and be able to take the current or old version of the exam. And that window of time that they can do that will be through March of 2028. But as of April 1st of 2028, there will be a full conversion over to the new examination. So the test will launch in the fourth quarter of 2027. And if people have not taken the test yet, if they take it for the first time after the new test has launched, they will be taking the new version of the exam. But if they have taken it prior to that and have been unsuccessful, they'll be able to have the choice to take the new exam or to take the version of the exam that they had taken previously. So I thought that information was pretty good. Starting on April 1st, 2028, when they're fully moved over to the new version of the exam, then the exam will increase in price from $600 to $650. We did talk about that at the last Licensed Psychology Advisory Committee meeting. We also talked about that at the last Master's Level Psychology Advisory Committee. Both committees expressed concern about the price increase. There was also messaging from ASPPB that basically said there would not only be a $50 increase in 2028, there would also be an increase every 2 years thereafter, informed by the Consumer Price Index. And the direction that I had received from you as a committee and also the Master's Level Advisory Committee was to go to the mid-year meeting for ASPPB and to really ask hard questions about those increases, to really push for information and to see if other states and provinces were concerned about those increases in price. And so I did. I attended the mid-year meeting. There was a forum for administrators, and I brought up the price increases, and I asked if other states or provinces were similarly concerned, and I didn't get a lot of similar responses from, unfortunately, from other peer states or provinces. And I think part of the reason for that is we discussed how long it had been since the price of the exam had increased, and it has been about 13 years since the last price increase. So with no increase in price for the exam in 13 years, knowing how much work has gone into the new version of the exam and integrating the two different exams into one, I think most people were, at least the representatives from the states, there was not a lot of support for really a pushback on a price increase, moving from 600 to 650. So just wanted to relay that information. When we had the opportunity to speak directly with the ASPPB board themselves, I still expressed the concern from our state that we didn't want this to be a barrier for individuals taking the examination, that it would still be a factor in terms of, that financial impact to individuals. And so we did relay the information that we had discussed, but I really pushed as well on the increase in price that was every 2 years thereafter. And what I found is that, at least on that point, what I was told is that they did a poor job of messaging that announcement. And really, what they intended to have the announcement say was that they would have a conversation about the price of the exam every 2 years after the initial increase. Not that they were saying there would be an increase, but for transparency, they were intending to say that there would be a conversation, there could be a price increase, but then behind the scenes, a lot of board members told me, they hope that there is not going to be an increase, but they wanted to let people know it would be something that would be discussed every 2 years, and they would be taking information into account as part of that discussion. So that is a bit different than the original message that came out that said the ASPPB board would be increasing the cost of the exam every 2 years. But it was nice to get clarity on that. I think the position that we are in currently is basically, we know the $50 increase will happen in 2028, And then we will just sort of have to wait and see what position those future boards take for that association. And if there does tend to be price increases, we can renew our opposition to that, see what test the water in terms of, do we have the support from other jurisdictions to push back on that? But at least right now, I think we were one of the few voices that was expressing the same level of concern regarding the price. So unfortunately, that's where we are. So just wanted to relay that to you. Last time we met, you had given me direction. I did my best to go and relay the message, and I think our thoughts were taken into account. And so we'll continue to make our voice heard. That is one of our responsibilities as a member of ASPPB. But I just wanted to relay kind of how that went. In terms of other updates from ASPPB, the mid-year meeting I thought was a very good good mid-year meeting that was in Charlotte, and ASPPB provided a number of opportunities for speakers to present information. One of the real focuses on that conference was how to regulate different uses of technology with a focus on artificial intelligence, which of course is very much key to a lot of our discussions right now too. Another topic that was mentioned was how regulatory boards can be proactive in terms of sharing information with licensees as far as helping them become better professionals. I think there was a board maybe in Alberta that had a spotlight on a full day of maybe trainings or classes for licensees to basically help them or help connect some of the messaging from the regulatory board to their licensees. And I don't know that we have enough programming to offer a full day, but it definitely got me thinking about something like that. And I love the idea of being proactive and helping our licensees. So that gave me something to think about. There was also a speaker that talked about some additional resources for licensees that are struggling either with mental health concerns or with substance abuse issues. There are some states that have programs dedicated for that purpose. We really don't have a dedicated funding stream for that, but it was interesting to kind of read about or hear about what other states are doing. I think specifically maybe Arizona was one of the states that was highlighted. And so I'm going to be looking a little bit more into some of their programming and some of the resources that they offer to professionals. So, but I was able to attend the ASPPB mid-year meeting with both David Anderson and board member David Stevens as well. So I wanted to provide an opportunity. David Stevens, do you have any other takeaways from the ASPPB mid-year meeting or anything you want to share from your experience?
No, you gave a good summary. I mean, I do think that the ongoing discussion about governing AI is, the top issue. So very good programming.
Well, and David, I appreciate you attending that meeting too. I think, we have a really good amount of board member interest. We have board members that attend the mid-year meeting for ASPPB, those that attend the annual meeting. And I know David Stevens, has volunteered on a committee. Richard Nobles serves as the SIPAC commissioner. So we have board members that are very active and involved. So really appreciate all that you do. But those are my updates from ASPPB, but I'm happy to answer any questions if anybody has questions on those topics that I addressed or anything else.
If I might say, I really appreciate you having gone to the mid-year meeting and made the voices of psychologists and master's level psychologists heard with respect to the fee increase. I know that there have been concern amongst members here, and I appreciate you vocalizing them at the national meeting. Anyone else have any questions or thoughts about the updates that Dave gave around ASPPB? Seeing none, I'll move us on to our next agenda item, and that's an update from SIPAC. I don't have any major updates for you all. I will have a significant update for you at our August meeting. We are having, as Dave said, our mid-year meeting, and it's virtual, and that will be on July 13th, and that's a Monday, and it'll be all day. I serve, as I've told you all before, on two committees, one, the Finance Committee, and secondly, a committee to revise the bylaws and do some cleanup work with those. We have a meeting with that committee next Tuesday, and I will be in attendance for it. And I think that we are just about complete when it comes to cleaning up some language so that language can be parallel across bylaws and uh, regulations and those sorts of things and policies. So I will have a update regarding that in our next at our next meeting. I'll also likely have an update for you all from the Finance Committee. We are doing a fair bit of work when it comes to uh, investment of SIPAC funds and making decisions around how we would want to continue to work with ASPPB and the Memorandum of Understanding. And I can't get into a lot of that here, but once the Executive Committee, I believe, of SIPAC meets, I think they're meeting later on this month or at the beginning of next month. It'll be before the mid-year meeting. I will have the ability to talk more about some of the things that we've done in the Finance Committee, and I'll bring those updates to you in August. So there are a few different meetings that are pretty important that are coming up with respect to SIPAC. I'll also have updated numbers for the number of psychologists that hold an authorization to practice telepsychology or have the authorization to practice in person. So the APIT and the TAP. I'll have updated numbers after the mid-year meeting. Any questions for me regarding SIPAC and operational matters or things that I may be involved in with SIPAC? I will say this, that the number of psychologists that choose uh, to hold, especially the telehealth authorization, is growing. And the hope is that, excuse me, that New York will eventually join SIPAC within the next year, and that will make a significant difference. With New York on board, that would mean that New York and Texas and Florida would kind of the three of the big four states would be members of SIPAC. California does its own thing, and I won't get into all of that, but yes, SIPAC continues to grow and people continue to renew year after year. So I think that we have like an 85% renewal rate across all jurisdictions in the United States, which is encouraging, which is really promising, so that there can be access to psychologists across the United States. So again, if you have any questions, I can take them now or I can answer them offline. Well, with that being said, I'll move us to our next agenda item. We'll go to old business, and there are two items under old business. One being a continued discussion on the regulation of AI, and that has been an ongoing discussion within this committee. I'll turn it over to Dave to frame our discussion.
All right, thank you, Richard. I pulled an article from the ASPPB website that I thought would be interesting for you all to take a look at. It is called AI and Psychological Practice, Governance, Risk, and Responsibility, and I included that in your packet. I thought it was a really interesting article as it related to regulation and licensing boards. I also thought they had some interesting information here about the number of clinicians that use AI monthly. I know we did the survey of licensees last year, and at that time that we did the survey back in probably February of 2025, very few practitioners, pretty much across the board from the 7 professions we regulate, very few were saying that they use AI. But you could tell from the rest of the responses that there was some level of interest. it would seem like it was on the horizon, because some people said no, but I'm interested to learn more, or no, but we're thinking about moving that direction. And so from the article that is in your packet, at least some of the information in that article says that 29% of clinicians use AI monthly. So not an overwhelming number, but that's close to about a third. 52% of clinicians use AI to write and draft emails, and 32% of clinicians use AI to summarize content. So I found that to be kind of interesting. Um, I thought it was interesting. Some of the conversations in that article talked a little bit, similar to what we have talked about a little bit, but I thought it was interesting. They talked about AI literacy, and the importance of understanding AI. And I think for some people who have just kind of avoided AI, I think we're all kind of coming to the conclusion that it's not going anywhere. It's going to be around. It may be evolving and changing. We may think about AI differently in the future, but I think there is a responsibility for people to continue to review this information and stay informed, and try to understand, kind of the movements and what's going on in this area. And then it talked a little bit about focusing on some of the different laws, and some of the consumer protections in different states. So if you have not had a chance to look at the article yet, I would encourage you to go through and looking at some of the information there. There's also some information about Canada and how AI is being viewed as well in Canada. There are some differences with government and laws when you go United States versus Canada, but I think some of that information is still interesting to be taken when you're digesting this information. So I know the committee has had an ongoing conversation about regulation of artificial intelligence. Just wanted to provide a little bit more information for you all and provide another forum for you if you had any additional thoughts or discussions on the AI topic.
Dave, could you mention that the matter of other advisory committees having submitted to the board recommendations regarding AI?
Yes. So at the last board meeting, there was a recommendation from the Social Work Advisory Committee that dealt with the regulation of artificial intelligence. Their positions have been similar to three of the other advisory committees that have forwarded recommendations. The social workers, their advisory committee, put forward recommendations that it would be filtered through the unprofessional conduct regulations, but it would focus on making sure that confidential information is kept confidential when using technology like AI, that there would be informed consent if you're using AI in terms of client care or client services. And then they had a preference for allowing individuals to opt out of care if someone was using AI, or at least opt out of AI being used for their care. And in past board meetings, there were also recommendations from other committees. At the March board meeting, there were recommendations from the Behavior Analyst Advisory Committee, the Master's Level Psychology Advisory Committee, and the Professional Counseling Advisory Committee. And their recommendations were all somewhat similar. I believe there was at least one committee, though, that basically said in terms of the opt-out, it would be nice if that was feasible, but as AI is getting more and more embedded into technology and processes that some of these entities are using, it may not be feasible to have that be an expectation that people would have the ability to opt out and still receive care. And so that is a sort of a small point of divergence between some of the committees, but in general, they have focused on the confidentiality piece, the informed consent piece, and then there has been mostly agreement to allow individuals to opt out of AI being used for client services, although there has been some dissent for people thinking that perhaps that's not reasonable to expect the ability to opt out. So currently, right now, we've had 4 advisory committees. I'm not sure that all 7 will make a recommendation on the regulation of AI, but I think ultimately the board is going to be having a conversation about this at a board level to see if there should be sort of a uniform expectation across the board for all the 7 professions, or if there should be something unique for one profession or the other.
Thank you, Dave. I really appreciate that. And I think that what this committee wanted when we discussed this at our last meeting was to hear what other advisory committees might be suggesting or recommending before we submitted a recommendation or suggestions to the larger BSRB. And given the information that's been presented to you all tonight, I'm wondering if folks have any particular thoughts about the most common recommendations that have been sent up to the BSRB. And again, that has to do with confidentiality, informed consent, and having an opt-out option when it comes to the use of artificial intelligence. And again, like what Dave said, we don't have to necessarily come up with a recommendation from this committee, but if we do want to do so, I would want to have a discussion with all of you, given what you now know, and make a decision as to whether or not we would want to send anything up to the board. So please, I want to have a little bit of time here to hear what folks are thinking in terms of making a recommendation and what that recommendation or those recommendations might be.
And Richard, I'll make one more comment or maybe two before we open it up for discussion.
Please.
I just kind of wanted to also relay that there have been some other topics that have been discussed that were basically rejected as official recommendations. So
Oh, please, yes.
I did want to focus on the recommendations because that is what has been forwarded to the board. There were a number of other things that were discussed that were basically rejected. One of them that I think that, it's not to say this is without merit, but there were some conversations on, should the BSRB try to make an attempt to regulate AI itself? And because right now, what a lot of the recommendations are focusing on is not regulating AI, it's regulating practitioner responsibility if you're using AI. And I think one of the reasons why this topic didn't move forward as a recommendation to regulate AI is it's very difficult to figure out, how to regulate AI. That's a much larger conversation. There's also, at a state and national level, there's differing opinions about whether AI should be regulated in certain ways. And it just seems like a much larger topic than perhaps what we as a regulatory board would be able to handle in terms of regulating artificial intelligence itself. But in terms of our lane or our jurisdiction, that really does have to do with the individuals that are licensed to provide services. And so going to the unprofessional conduct and looking at the standards of care, that if you are using artificial intelligence, here's the expectation that really fits cleaner into sort of our limited jurisdiction. But if people are interested in knowing kind of what the state has talked about in terms of regulating artificial intelligence, I did want to highlight a couple bills that were introduced during the 2026 session. I don't think we've talked about these bills in this committee, but we talked about them in the Marriage and Family Therapy Advisory Committee earlier this month. So I thought I would just highlight these two for you. One of those bills is Senate Bill 405. It was introduced during the 2026 legislative session. It's a short bill. It's just about 3 pages long. It was introduced in the Senate Committee on Federal and State Affairs. But what Senate Bill 405 would do, it's an act concerning artificial intelligence. It would make it unlawful for a person to knowingly train artificial intelligence to encourage or support suicide or the unlawful killing of another person, provide emotional support, develop emotional relationships, act as a healthcare professional, simulate human or encourage isolation, provide civil actions for the violations, and it would provide a potential remedy for damages and other things if someone violated the new statute. And what this bill did, or it was introduced, this bill didn't move forward. It's not like it was put before the legislature and they voted it down. but a lot of bills get introduced each year. Not all of them make it out of committees. So this bill was introduced in the Senate Federal and State Affairs Committee. It was available to be worked, but it didn't move out of committee this year. But what we often see is that some bills get introduced and then maybe in future years they move forward. So I would encourage you to take a look at Senate Bill 405. It seemed to kind of focus on artificial intelligence chatbots, but it also clarified what type of chatbots it was not meaning to restrict. And so I thought that was kind of interesting. So, like I said, it's a fairly short bill. Some of it just focuses on definitions and different things like that. But in that bill, it says it would be unlawful for a person to knowingly train artificial intelligence to encourage or support the act of suicide, encourage or otherwise support the unlawful killing of another person, provide emotional support, including through open-ended conversations with the user, develop an emotional relationship with or otherwise act as a companion to an individual, act as or provide information as if the artificial intelligence is a licensed mental health or healthcare professional. Otherwise act as a sentient human or mirror interactions that a human might have with another human user, such that an individual would feel that an individual could develop a friendship or other relationship with artificial intelligence. Encourage an individual to isolate from such individual's family, friend, or caregivers, or provide an individual's financial account information or other sensitive information to such artificial intelligence, or simulate a human being, including an appearance, voice, and other mannerisms. So there's a little bit more to the bill, but I think that provides most of the explanation. So feel free to take a look at that bill if you get a chance. The other bill was introduced in a committee this year in Kansas. It did not move forward. It was House Bill 2592. It was requested by Representative Holheisel, and it was in the Committee on Federal Legislative Modernization, so the House Committee on Legislative Modernization. And what House Bill 2592 would have done is it would have created a Kansas task force on artificial intelligence and emerging technologies. And then it would have outlined the membership for that committee. And then they would have given recommendations to the legislature each year in terms of artificial intelligence topics. So the bill itself says that it would establish the Kansas Task Force on Artificial Intelligence and Emerging Technologies. The task force shall study and evaluate the impacts, risks, and workforce implications and regulatory needs of artificial intelligence and related emerging technologies. The task force shall explore the use of artificial intelligence through the state to improve the efficiency and effectiveness of state and local government operations and the responsible integration of artificial intelligence into public education. So, like I said, those two bills were introduced. They didn't move out of committee, but some of these topics are just being discussed, and a lot of people have not done sort of the dive that we have done into this topic yet. So wouldn't surprise me if I see similar bills come forward in the future, but I did want to put them on your radar. But sorry, Richard, I know I detracted from the direction that you're going for the recommendations from the committee, but I did want to let you all know the whole conversation as far as should our jurisdiction be about trying to regulate AI or trying to regulate practitioner responsibility. There is information out there to look at AI itself. And I think the state of Kansas is exploring that. And so I think other people are going to be walking down and having those conversations in future years. But at least as far as the BSRB and the work of the advisory committee, I think the focus is probably right to focus on what should the advisory committee recommend in terms of responsibilities of practitioners if someone is using AI. So I'll turn it back over to all of you, but just wanted to give you a little information and some things to look into if you're curious about those topics.
I have a question. So if memory serves me correctly, those two bills are now, are they dead? Because we are now ending a 2-year cycle and they would need to be reintroduced in January. They can't be left over like they can sometimes if you're within a 2-year cycle, right?
That's correct. Yeah, the
Okay.
legislative sessions are each 2 years. I think they call them bienniums. And so you can introduce bills either the first year or the second year. If bills move to a certain point and are not exempt from dying, to so to speak, bills can die, but at the end of the 2-year biennium, anything left over that has not officially made it all the way through is gone. So next year, when the legislature starts the 2027 session, they will have a whole new opportunity to introduce new legislation. But anything that was still on the books when the legislative session stopped this year is now officially dead. So
Thank you. I appreciate it. Any other questions or thoughts or concerns about what David just gave us in terms of those bills? In returning to the previous question about recommendations or not sending recommendations, I would certainly like to hear thoughts from the committee regarding any recommendations we might want to offer, and general discussion about what you've heard from other advisory committees.
I certainly, excuse me, agree with the idea of avoiding trying to regulate AI in some way that, if it's even possible, which obviously it isn't. And like a bill, the first one that Dave mentioned, to me seems kind of like trying to take a stab at a much bigger issue. I appreciate the sentiment, but at the same time, my other thought is I think it is important for groups to organize and try to think things through. Maybe that second bill makes some sense. I think what's really important if we have groups of people thinking about this is we get the right people in the groups that have expertise, that know what they're talking about, rather than just folks that are, kind of have that lack the knowledge base. I think lots of people can be involved, but that kind of representation seems to me to be really important. As far as any recommendations that we were to make, I really like the article that David, you also shared. It's got some good ideas. They're real kind of basic matters like documentation. I don't know whether we're kind of at the place that we can speak to that, although I do strongly believe that clients, patients need to be informed. That we're using AI, that we're recording. I've heard an example recently of someone that didn't address that issue, that they were of the opinion that it was just great and fine. And I don't recall that there was any discussion, the fact that discussion needs to be had with the patient, or at least inform them opting out and so on. What constitutes appropriate documentation? I don't know that we can exactly say, although that might be worth thinking through. So anyway, long and short is I think looking at that article for some sort of general parameters to be thinking about in terms of our recommendations makes sense.
Thank you, Ned.
Yeah, I also found the article very helpful, and something that I think was important the article brought up was that there is evidence of independent clinical judgment even when there is some sort of AI, and I think that's something important to consider. And I know we may not at formal recommendations yet, but disclosure, confidentiality, maintaining clinician-based judgment, whether clinical judgment, actuarial judgment, informing that, but also not letting AI become an independent diagnosis machine, which I know is a gross oversimplification, but I think that's kind of what it is. That article was hinting at, is making sure clinical judgment remains.
Yeah, I agree with Jay a lot with that statement. Almost a regulation or a recommendation that says, if you incorporate AI, you are still engaging in independent clinical judgment. And you're affirming that when you renew your license, or you put that in your informed consent that you are engaging in independent clinical judgment. So,
And to me, that's not, I mean, the example I think of is that we'll get interpretive reports for MMPIs or WACEs, and yes, I think it's fair to use sections of those, but that never overrides clinical judgment. You're still interpreting. You're still at like it. I mean, unfortunately, clinicians might do that. They just wholesale copy and paste without, adjusting or incorporating fully. And so I kind of see AI in a similar manner.
I appreciate this discussion, particularly as psychologists, because we do the integrated reports, we do the larger assessments, the neuropsychological assessments, the ones for diagnostic clarification. And Jay, to your point, unfortunately, I have seen reports where it's clear that there has been a copy and paste job when it comes to, especially things like an MMPI or MCMI, like
Yeah.
the things measuring emotional matters. So yes, I think that this recommendation, or this thought of a recommendation coming from this committee, I think is really appropriate and really astute.
and then I would love to add some more recommendations. I believe, David, you spoke at our last meeting about how when we were looking at our statutes and regs, that those are just related to humans. And so when someone talked about licensing, I think it would be interesting I don't know if this is a recommendation, I don't know if this is regulating AI, but if we made sure our titles were regarding humans. So an LP in the state of Kansas is a human. And so if that title is used, it's a human. If you're a social worker, it's a human. And then the other thing I find this is a worrisome thing for me, is recommending that clinicians shouldn't be in the business of supervising bots to treat people, because again, that's not a human treating somebody. I don't know how that regulation works, but I would be pretty disgusted if our clinicians just became bot farms that were doing online therapy. And then this is one that I've probably said a couple times on here, is we should be referring any high-risk client to a human as clinicians. So whenever possible, the recommendation is at risk, severe presentation, they should be working with a human. So that's kind of the main ones for me.
I'm just writing some of these things down, so that there's, reference, and this is something that can be taken to the larger BSRB, or if we have a discussion about it at our annual meeting. Like, these are, I think, very helpful additions to what has been discussed in the other advisory committees. I'm wondering what this committee might think, whether it's, kind of collectively or individually, when it comes to the matter of having an opt-out option. So as David said, there was at least one committee that said, uh, given how integrated AI is, or is becoming, that an opt-out option might not be feasible, or maybe it just may be something that would need to be considered differently. I'm wondering what members might think about about that in particular. Do folks feel like there should be an opt-out, should not be an opt-out, or case by case? I'm just wondering what folks might think.
In my opinion, it's really important to give clients the option, both as to whether they're going to be recorded and as to whether AI is going to be involved in any way, whether it's creation of progress notes or treatment planning or whatever the case may be.
I agree. And I wonder if that means in certain cases when AI becomes so integrated, that means they are opting out of services with that provider.
I was thinking the same thing. Like, as much as they can choose to not be in our service, we can choose to not service them with appropriate referrals and whatnot.
I don't know. Does anybody have a system now where it's integrated, like whether it's integrated in the as a part of the electronic health record automatically? Then maybe they could speak to, is that possible for people to opt out of that?
So I'm using Simple Practice, and they are going hard on AI involvement. They've got kind of two different things, it seems like. I think they've got I'm going to mess up the terms, but there's a note taker, and then they have like an assistant or something. And I don't know that the assistant thing it might still be beta. But I am 99% sure in both cases you can essentially, if you use the note taker, it transcripts the session, and then that is where it will take and draft a note for you. And then I think the assistant thing that's different than that will go into and look at records and make summaries and different things. But I believe you can turn both off. I know you can turn off the transcript because you have to turn it on.
And I use Simple Practice for my private practice portion. And Matt, I think that you are right that you would have to turn both of them on. I don't think that the assistant portion is automatic. So there would be necessarily an opt-in for both.
So I use
That helps.
therapy
I just
notes
think of like inpatient settings, for an instance. At some point when we catch up, people aren't going to be able to be referred out. They're just there. So, yeah, it's better to have understanding of how this works and what could possibly be coming down the pike.
Daniel, were you going to say something?
Yeah, I was going to say, so like I use therapy notes and it's something pretty similar where there's a couple of different options that you can either record the session and have it generate a note, which I have never used and have no intention of using. And then there's another option where you can type up a summary of the session and it will then generate a note for you, but it's embedded into the system. And so you can turn them, you have to turn them on or off, and you would have to start the recording. So that is a separate step. Regarding the consent part though, I do like the option of a very clear opting out, because at least in the therapy note one, from what I can see, and I'm pretty sure this is what the client sees, is basically they either sign that agreeing to the use of AI, and whether that's recorded sessions or the note summary that then generates the document, they either sign it for use of the AI or they don't sign it, which sort of, right now working under the sort of assumption that they don't consent to that. But I do like the idea of having a specific opt out where it's clear that that was discussed. It's clear that they saw that and that they said, no, I do not consent to this, versus just not signing the form. And then as clinicians, we're left to wonder, did they not receive this form, but they would be okay with using this? Or, we don't have to make any guesses just because AI is becoming so integrated.
I really like that, like a clear opt-out where you send the form and you can say, on the form, have check boxes or however you want to do it, saying, yes, I consent, or no, I absolutely opt out, and having that be a part of your standard informed consent process. I like that idea personally. Jennifer, were you the one? I think you may have been talking to us either last advisory committee or maybe the one before about the VA. Are you at the VA, and were you talking about the integration of AI into its EHR?
Yes, and it is coming, but I'm not using it at the VA. I'm only using it in my private practice, in simple practice.
Okay,
Uh-huh.
because
The
that.
VA, yeah, the
Oh, go
VA
ahead. I'm
is,
sorry.
yeah, the VA is integrating AI into all aspects of care. I'm just not using it yet because the service that I'm in at the VA doesn't really lend itself very well to what is available at this point.
That I think that gets to something that Tiffany was saying a little bit earlier, and I find this point to be fascinating. I hadn't thought about this, like on inpatient settings and the use of AI, like I think there could be a whole number of issues with consent and the how AI would be integrated on an inpatient unit. Um, yeah, that I think that's a really good point to think about, especially as we talk about the integration of AI into larger systems. Any other thoughts or reflections or even questions that folks might have about this matter?
I guess I think I'm following up on what Tiffany's saying, that at some point, especially like on an inpatient unit, it may become out of the clinician's control, what's being done. And it may be impossible for a patient to opt out, in certain circumstances in particular. Um, I'm not sure how that would work. You're down at Osawatomie, where Tiffany works, and it's like, we're using AI. Well, no, I don't want that done. Well, right now, maybe that wouldn't be an issue, but in a really fully integrated system, and we're talking about AI as if it's a unitary thing, and of course it isn't. It's a whole lot of things, and how exactly that would operate in a big um, uh, healthcare system. I'm thinking of our own at KU Medical Center. I, oh yeah, yeah. So what exactly opting out is, and then becomes kind of a bugaboo or something. I don't know what you call it.
No, especially where we work net at KU Med, the logistics around that, um, I think would be very, very, very complicated.
I like what you said about the definition of that as far as what are they opting out, because one of the things I was just thinking about is I was talking about both there are options, and so if a client is okay with maybe the note summary generation but not okay with a session being recorded to generate that, right? So that is a good point on what are they opting out, what can they opt out of.
Yeah, and I think that if we were to offer recommendations at some juncture, one that I would have would have to do with the recording of the session, and that being separate and apart from the use of artificial intelligence. Like I think um that would be really important, because a lot of these AI tools, they necessarily use recordings. I mean, you can dictate like what Matt was saying, I think you can dictate a summary, or it might have been Daniel, where you can dictate a summary and then it can spit out something. Um, and that's the recording of your own voice, but a lot of these use the session transcript, and that requires a recording of the client's voice or the
Well, and the
patient.
one that I was talking about doesn't use a recording of your own voice to dictate. You type in a summary and then it takes that and turns it into like a soap note, basically.
Oh, okay.
And so I've seen clients that are a lot more comfortable with that because to them it's no different from us typing a note anyway. It's just AI is just helping to organize it versus, like the recorded session summary, which kind of stood out to me when that was being talked about as far as the opt out and what does that mean?
I do want to be mindful of the time because we do have another item of old business that we've been talking a bit about, but I appreciate this discussion. It sounds like we don't have any formal recommendations to send up just yet, or if we choose to do so at all, but we do have a number of additions to proposed recommendations that have already been made. And I really appreciate the discussion coming out of this advisory committee in terms of adding to or potentially adding to recommendations that have already been made. So I appreciate the discussion, and we can certainly loop back around to it if we think that yes, we want to codify some of these things. If folks want to read the article again and say, yeah, I would like to think about us moving forward with some of the things that were said in this article, we can certainly do that. So with that being said, I'll move us to the next item of the agenda, and that is a continued discussion on possible changes to the postdoctoral year requirements. And Dave, I'll have you begin to frame this discussion for us.
Okay, and you may recall we've had a few different conversations about this topic, and there was a past individual who had attended an advisory committee meeting and requested the advisory committee consider flexibility concerning the postdoc year requirement. The advisory committee has talked about some different options, and I think at the last advisory committee meeting, there was a desire to have Leslie Allen, the assistant director and licensing manager for the BSRB, come back to an advisory committee meeting to talk about some of the technical aspects of what could be done as far as adjusting the regulation. And so I talked to Leslie. I made sure that she was able to attend, and unfortunately, there was some really problematic weather here in Topeka, but thankfully, Leslie was still able to attend the meeting tonight. So she can field any of your questions. And if she had any other considerations or concerns, I wanted to give her an opportunity to kind of relay that to the advisory committee members. So I'll turn it over to Leslie. And Leslie, if you have questions or if you want to open it up for individuals to be able to ask you questions from a technical standpoint, feel free to take that either direction. So
Okay. So I mean, as far as regulations go, it would require a change in the supervision requirement regulation. It would not require a statute change, I don't believe. And it might affect the education regulation because that's where the internship requirements are, if it's not APA accredited. But I didn't, did people have specific questions or?
Leslie, before I turn it over to the other committee members for questions, I think you and I had a discussion about if a possible change in this area could impact possibly reciprocity. If it changes our licensing requirements, could that impact an individual's ability to get licensed somewhere else if we have a significant change in this way? Do you have any thoughts on that you'd like to share?
Well, last time we checked, but that was quite a while back. I think maybe 17 states did not require the whole year of postdoc. And so it would affect people maybe going other places. And I did notice today, and maybe the committee can help me with this, like Missouri allows you to use practicum and pre-internship and things like that, but they don't let you use the first year of a doctoral program unless you have a master's degree in psychology or a closely related field. But they do require it for health psychologists. So if you want to be a health psychologist in Missouri, you have to do the postdoc year. And I noticed also that their hours had changed a little bit, but I'm not sure what that means for Kansas because we don't have that designation. I'm not familiar enough with it to know, how that would affect people going other places that do have those kind of licenses.
So I am not an expert on licensing in Missouri, but if I remember correctly, and I still hold my Missouri license, that the health psychologist designation is in place to, well, first of all, it's not required that practicing psychologists get the HSP, but it's in service, it's there because folks who are like IO psychologists, and please disabuse me if I am wrong, for those who are licensed in Missouri also, I think that IO psychologists can get a license as a psychologist, but they can't be licensed as a health service psychologist because they're not a clinical psychologist. And I think that the HSP is for those who are clinical psychologists, and I'm smiling because a member is also smiling. So
Oh,
so if anybody has I'm sure that folks may have thoughts, and
Oh, I
you
will
can
go closer.
express them or not, but oh, what was that, Tiffany? I'm sorry.
Oh, sorry. I didn't know my mic was on.
Does anyone, am I incorrect about that? Anybody know? Okay. So take that with a grain of salt. So I think that may or may not have an effect, back to the original point, on what that would do, what that designation would, if we had such a designation. I think that's what you're kind of getting at, Leslie, like what that would do if we did not have the postdoc.
right. I do know that I talked to someone recently and they said that in Missouri, while they don't require it, they still encourage it. And people do complete postdocs, but they can get licensed in the meantime, so that they can practice and be reimbursed while they're doing it as well. Even if they don't have to do the postdoc, a lot of them choose to do it.
But they still get licensed.
Yeah, but they can still get licensed earlier in the process.
Okay. Ned, if I'm remembering correctly, part of this discussion, this is going back maybe 2 meetings now. Part of the discussion that we were having centered around something that Leslie just focused on, and that was what Missouri delineates or says about what hours from practicum would be allowed. And I think that and tell me if I'm wrong, I think that you may have been raising the matter of, where in the doctoral, where in the process do we draw a line, or is there a place that would be appropriate to draw the line between hours that would count versus hours that would not count? And first, I want to make sure that that was you. And secondly, if it were, wanted to get your thoughts maybe on what Leslie just said about not using, or not being, at least in Missouri, not being able to use the first year of hours that might have been accrued in one's doctoral program.
I certainly have thought about similar issues and probably brought up matters, related to this. So probably you're remembering that correctly. There is a whole issue, and I think it was discussed as best I can recall too, that graduate programs, at least that are accredited, have people that are following these practicums, and so the hours are legitimate and so forth. I have lots of thoughts about this, as I have expressed in here, and I won't go into all of that, but it seems to me, it's always seemed to me that people in doctoral programs do practicums, and I don't understand why we need to go back and count hours. I think the decision is, do we require a postdoctoral year or don't we? That's the issue, not going back and counting hours. Then it gets so convoluted, and where does that wind us up? So anyway, I'd just be repeating myself if I said the same thing, which is a tautology. But I just think the issue is, do we count it? Do we require a postdoctoral year or not? And going back to what you're referencing, Leslie saying, what it reminds me of is that whole issue of reciprocity. I have no question that it would affect matters. I think that we'd be in still the minority to allow this, and I don't want Kansas to be in the minority when our responsibility is to protect the public. I'm sorry, I'm starting to go off, but I'll say one more thing that has bothered me about this, which is the suggestion that somehow if we eliminated that requirement, that then there'd be more folks practicing in rural areas. I don't know of any evidence that would support that any of the things that have been done to, in this area to increase rural providers. I don't see how that would happen. I think most of the people that got licensed would still go to the city and suburban areas. I don't know why that would increase that likelihood.
No, thank you. I appreciate your feedback. And yes, I don't think that I knew the number of states that had eliminated the postdoc. And I had presumed, I think, that the number was higher than what you cited, Leslie. But that's I think something to consider in all this, that we would still be in the minority of states that that have eliminated the postdoctoral year.
Well, and when I say that number, that was several years ago, so it may have grown since then.
Not by much. I
Okay.
Maybe a few, but I think it's not too far off, or substantially in the minority would be.
Anyone else want to contribute or weigh in on this matter?
I still think it's a positive thing to give people the option to not have to do the postdoc years and allow them to start practicing sooner. I think that helps with some billing concerns. I think it also helps with letting them kind of choose their path a little bit more, creating an easier path to licensure. I would be interested to see how many overpopulated states or high population states have removed the postdoc versus more communities and states that have less providers. And so those are probably just targeted initiatives to try to increase licensure in states. I think one of the challenges with rural psych, and I'm just saying this, I'm not saying that this has science behind it, but if there's not a supervisor out in that rural community, you're not going to get another psychologist out there. But allowing someone to have the hours to be able to practice and not do a postdoc, they'll be able to set up shop in a rural community easier. That would be kind of the perception I would have. That would create maybe more access. So, because I think that's one of the biggest challenges is if you don't have a supervisor, you're not completing a postdoc. And so we need to create the opportunity for there to become people that can supervise people if they want postdocs, which that's not getting eliminated. And that would give them that ability. And I think as supervisors, we just need to be ethical and let them know, like, this might limit you here in these other states, but I'll still supervise you if that's part of your contract. And then that creates that opportunity while they're still being able to license as an LP.
Thank you, Chris.
I'm curious, and this is my I don't have the information, but Chris, you bring up an interesting thought about kind of the reimbursement side of things from a private practice standpoint. I don't know of any way that I can support a postdoc because at the end of the day, fee for service private practice world means that if there's no way for that person to bill, then there's no way for me to pay them because I don't have any money coming in. And so it almost feels like some of it is kind of tied up in that, like available postdocs versus areas versus, if you're a larger organization or something grant funded or something like that, then a postdoc is going to be something you can offer. But because I've had individuals, not usually psychologists in this area, come in asking for, internships and postdocs and things like that. And I'm like, I would love to help train you. I can't afford to. And so from that, small, rural, private practice, all that, it's just another element. And I don't have the answer to it, but it's definitely an issue that I've experienced.
No, thank you, Matt. Appreciate it.
I know at KU, and I'm not sure whether this would apply in a private practice, you can bill a postdoc that has a temporary license under the license of the provider, the fully licensed provider. So that's how we do it here.
How does that? So essentially, I use my NPI as the billing. I bill a regular code. And that's I guess my thought is like, what along those same lines is it the temp license that allows that to work? Because I could have my son come in and talk to somebody and go, well, he's working under me, and mind you, he's 14, so this is a terrible idea. And then go, well, no, these are all of these people do services under me, and then because even further, my reimbursements as a psychologist are higher than my master's level providers that work here, and so I don't know how it lines up as well, and if that's like maybe an organizational NPI versus a private practice NPI. And again, I have no data here. I just have questions.
No, we have to bill under our individual NPI here. And I think to answer your question about license, yes, I believe they do have to have a temporary Kansas license in order for us to do that.
I know that to be the case in Missouri definitively because that is what happened when I was on postdoc in Missouri that I could, but the only insurance company that allowed for that, I believe, was Missouri Medicaid. And the commercials, you couldn't do that, but you could under Missouri Medicaid. So I had to have a temporary license And I was also on the psychiatric inpatient unit, and that makes things, you know, differently, or that makes things different. But yeah, you can do that in Missouri for Medicaid patients or clients.
I do imagine that it would make sense that that would be excuse me, an insurance specific, because they all have their own rules, right? And they get to make them up as they go along. And um, do we then submit that? Like, I guess is that on our system that this person has a license? Because if I'm putting it on a CMS form, then I'm not mentioning them anywhere. And so again, I mean, not that I'm trying to game a system, but is that just between ethics that yes, this person does have a license, yes, they are a valid person?
I think that at least in Missouri, I think it had to be documented somewhere. I'm not sure where. And I'm trying to remember because I had a postdoc years ago when I was working on the Missouri side, and she had a temporary license, and she could see Medicaid patients. Um, but I don't know how that was handled with billing and like the CMS forms, man. Like that part I didn't know because that was all done in the back end and I had no control over that. But that is a good question.
It has me thinking, and I think what I will do, and I can fully report this back, but I mean, I've got a Blue Cross / TRICARE rep, and I've got no problem sending them an email and going, hey, if I wanted to do this, is that a thing? And seeing if they can even kind of pipeline some of that info.
That could be helpful. Thank you. Any further thoughts or contributions that folks might want to make uh to this discussion? That being said, it does not seem like we have a consensus here with respect to whether we would want to, even if we are at the point where we would want to take a vote on making a recommendation to the board and what the language would look like if it's just a clean strike or whatever the case may be. Leslie and Dave, I'll ask the both of you, how would you like for us to proceed given where we are in this discussion? What would you need to know, or um, what would you need to know in order for us to make next steps?
Well, if you wanted to forward something to the board, I think there would need to be sort of a very clear recommendation from the advisory committee. So it would need to be something that a majority or consensus of the advisory committee would agree to.
Mhm.
And I think for the board to fully understand it, I think it would be helpful to kind of have some reasons that could be provided to the board if something was being forwarded. And I think for Leslie, she would be the one I think who might explain some of the technical changes. So if there was a
Mhm.
recommendation, I think officially deciding how that would look from where we currently are at with the regulation through what a new proposal would look like. So I think as far as the technical steps, I think there would need to be agreement as far as the technical steps so that Leslie could mark up the regulation appropriately. There would need to be a very clear recommendation that could be forwarded to the board so that Richard, you as chair, could explain that to the board at the full board meeting. And then to have some generally agreed upon reasons for why this would be a helpful change if that was something the advisory committee would want to bring forward.
Okay. Leslie, do you have anything that you would want to add to what Dave just said?
No, I think that's about covers it.
Okay. I think where we can start to go with this is if I might ask members to consider the kind of a Punnett square in a way, like the advantages and disadvantages of keeping the postdoc, the advantages and disadvantages of of striking the postdoc. And if we started to kind of systematically go through those things and present them to one another, we could then make an informed decision about the direction down which we would want to go. And that's when I think, from what it sounds like, Dave, once we have done that, we can start to talk about the technical things within the regulation as to whether it's a clean strike of things or if there are augmentations that would need to be made. Am I from your standpoint, Dave, am I kind of putting this together correctly?
Yeah, I think so. I mean, I think in the past when there's been recommendations, if there was basically universal consensus and it was a real simple concept, that's something that's easily forwarded to the board. Like, let's say, you have recommendations on new advisory committee members. You have a discussion, you have a consensus about one or two people you want to forward to the board. That's a very clear thing to do. And this, at least from kind of what I'm hearing, there are different viewpoints and in different positions, which there's nothing wrong with at all. But I think for some of these things to be, like you said, worked through, I think probably the advisory committee would have to narrow down some of these things that would be a change from the existing system. So maybe part of that would be to ask advisory committee members to look at the relevant regulation. And Leslie, could you remind the advisory committee which regulation that is that the majority of this would fall under?
So 102-1-5A is the supervision requirements. But then also, if you look at 102-1-12, it has like what an internship must include, and how often supervision takes place and all of that. So those two regulations would be the most changed for this subject.
Okay. Yeah, and I mean, I think, we can talk about conceptual changes sometimes, and then Leslie or I or working together, we could kind of figure out how to implement things conceptually. But we do ask the advisory committee members to familiarize yourself with the statutes and regulations. And so, since there are different ways of looking at this, if individuals who had recommended changes could just take a look at the regulations and feel free to reach out to me or to Leslie in between this meeting and the next meeting, and we'd be happy to assist you. But maybe that would be the cleanest way to kind of have this be driven by the members of the advisory committee, that if they have a proposed change, they could kind of work with us, and then we could bring this back to the next advisory committee, so that way we could really show you or show the rest of the members what potentially could be changed to make the conceptual change that we're kind of talking about today.
Any any questions from members regarding that? And is it clear to members as to what they could do between now and our next meeting?
So I have a question that may be an impossible question, but since there are states that don't have this requirement, are there data sets on these states as far as like feelings of readiness to practice or patient outcomes or things like that based off of not having the postdoc year versus having the postdoc year? Like I said, that may be an impossible question, but
I don't know of anything like that, but we could look at maybe ASPPB might have something.
We could also submit it to AI and see what
Only if you record it first.
do that.
No, I like the idea of either looking on ASPPB's website or asking for information from ASPPB. To your question, Daniel, I don't know of anything either. I wonder, and this would potentially be a bit of a logistical nightmare, but I wonder if APA would have anything. And looking for that information might be tedious, and it may not result in anything fruitful either. So I would hate to send or go down a rabbit hole or go on a goose chase looking for that information and it's not available.
I'll see what I can
Second,
find on both.
No, thank you,
I was
Leslie.
gonna say, that'd be awesome. I know there's a couple states that have been doing that for quite some time. I think, is it Arizona hasn't required a postdoc?
They do not.
Yeah, I think I don't think they ever, well, I can't say they never have, but it's been a very long time that they haven't. So I don't know, maybe something coming out.
And Tiffany, are you saying that you think that they may be, or they may have collected data on
Ye-
these matters that Daniel
Yeah,
has
since they've
raised?
been doing it for so long, I would think there would hopefully be something.
Mm-hmm. That's a good point. I'm just writing a couple of things down. Given that it's 7:45, any last questions, and are members clear as to what we could do between now and our next advisory committee meeting in terms of looking at the regulations and seeing if there are any potential changes? And if you need the regulation number, again, please do email David or Leslie, and they can provide you with the appropriate regulations to review. That being said, there are a couple of items under new business. The first one has to do with and I don't have it right in front of me. That's the Texas and alternative licensing examination. And Dave, I'll have you frame this. I think that we had talked about this before. If there were new matters, certainly would want to turn to those.
Yeah, so earlier this year, we invited some guests from Texas to attend one of the advisory committee meetings and talk about an evaluation that they were doing, a feasibility study type thing that they were looking at, potentially creating an alternative licensing examination. And not that they had completely pledged that they were going to create the exam, but they were looking at other states and trying to gauge interest, that if they develop this, would there be other states that would be interested in having this as an available option? They said they're not looking to replace the EPPP, but given the uncertainty a few years back about potentially a requirement of 2 exams versus 1, at that time they had explored the possibility with their legislature of creating their own examination. Their legislature said, we would like you to do a feasibility study, see how much that would cost, see a lot of the details. And so even though ASPPB, their board, changed their mind about requiring 2 tests, and it has moved forward on the integrated EPPP, the Texas legislature still approved the funding for the Texas Licensing Board to continue to look at what it would cost to put together an alternative exam. And so they came to one of our advisory committee meetings. They talked a little bit about the different stages and talking to people in different committees. And I think at that time, they also said if anyone from different states is interested in volunteering on any of those committees or tracking the information, there were some opportunities to do so. So I have not tracked the information that has followed, but we did want to revisit this topic because in case there were members of the advisory committee who had reached out to Texas or had volunteered, we wanted to give an opportunity for some additional updates. Alternatively, if you have thoughts about this now that you've had a little bit of time to think about it, we wanted to give an opportunity for that. If there's no new updates and no input from advisory committee members, we'll probably take this off the agenda for future meetings, but we did want to give you another opportunity to talk about this topic if you had new thoughts.
Seeing none, going once, going twice. Well, as Dave said, we can kind of take this off the agenda for now, and it can still, I think, be put back on for reconsideration. If folks have any thoughts, concerns, questions about either what was discussed or what the process is, where the process is right now with the state of Texas, or any other questions, please don't hesitate to reach out, and we can certainly have further discussion about this matter. With that said, I'll move us to the last agenda item, and Dave, please take it away with respect to potential changes to our meetings.
Okay. Well, thank you, Richard. So currently the advisory committee meets every other month, the second Tuesday of the month, usually, unless there's a conflict that we need to work around. And it has been between 6 o'clock in the evenings, usually till about 8 p.m. The Addiction Counseling Advisory Committee for the board moved to quarterly meetings about 2 to 3 years ago, and that has worked well for that group. A few of the other advisory committees have started to have a conversation about whether they would like to move to quarterly meetings. I think the master's level psychology group is moving to quarterly meetings for the next meeting. Marriage and family therapy discussed this as a topic and decided, at least for right now, they would continue to meet every other month. I'm not trying to sway the committee one way or the other. If you want to continue to meet every other month, we're happy to facilitate these meetings for you. But since the other committees were talking about it, I thought this could be something for all advisory committees to at least consider. So if you did want to have input on a possible change and making it quarterly instead of every other month, just wanted to allow you the opportunity to think about that and provide some input. Like I said, this being on the agenda is not trying to convince you to change. Just wanted to see what your preference would be.
Any thoughts from members?
Dave, do you know why those discussions are taking place? Why why would they want to reduce the number of meetings?
Yeah, so in the past few years, we brought a lot of different topics to the advisory committee. I came on board as executive director about 5 years ago, 5.5 years ago, and there were some topics we really wanted to make sure the advisory committees had a chance to weigh in on, like the review of the unprofessional conduct regulations, and we spent a fair amount of time going through those and then collecting input from other committees, bringing those back. And then in preparation for our review of all of our regulations. Leslie and I brought a number of other regulations to the advisory committee to provide input on. We put together the survey a couple of years ago and then spent some time as an advisory committee walking through some of those questions as a group, and I really found that to be a good exercise. I think some of the other advisory committees, now that we've brought some of those things to the committee, we've kind of caught up on some of our short-term goals and some of our maybe middle goals. And so some of those advisory committees have had meetings that maybe ended after about an hour. And so, or potentially they came to when they were putting together the agenda for the meeting and there really weren't time sensitive items to discuss. And so maybe they might cancel a meeting. And so instead of having that occur, they thought perhaps if they met quarterly, then they would be able to still use the 2 hours people had blocked. And if there were time sensitive things, they would always have the option to go back to every other month. But they just thought, based on what is currently being discussed and some of those things, they thought quarterly was good for them.
I could see it. Every 3 months.
So I appreciate you weighing in on that, Ned. Would folks like some time to think about the move or a potential move, and maybe we can revisit this in our next advisory committee meeting? Would that be helpful, especially considering um all of the, as Dave said, the topics that we have gone through, and we've completed a lot of work over the last few years, and that's something to consider when it comes to the frequency with which we meet. So maybe that is something that we can think about also between now and our next meeting, and we can revisit the topic. Does that sound good to folks?
I have one question.
Sure.
And David, you may have just said this and I totally blanked out on it, but I'm wondering, since you get to sit in all the other meetings, and you can be as candid as you choose to, do we have more to talk about, or do we talk longer than the other ones do since they're running out of things? And I'm thinking about, we've talked about maybe discussing prescription privileges. We're knuckle deep in this AI situation. We seem to have things to continue talking about, although I always, love the opportunity to save 2 hours in a year, I guess.
I would say I would say some committees have really in-depth discussions, and some committees the conversations are very short. I think your committee it's not the only one where you really dig into the topic and really discuss it, and I like that. I really enjoy it. But I think the postdoc year item is something a little unique to your committee. I know we've tried to bring some standard items to the committees, like the discussion of artificial intelligence. And some committees have basically said, we might make this a recommendation, but we want to keep this as a standard item, where others have said, I think we've talked about this topic and finished our work on it, so we can move it off the agenda. So part of it is kind of an approach. Some of the committees use it as an opportunity to collect more current information and really dig into stuff. Others are trying to knock items out. And so it just kind of part of it's an approach of just how people want these meetings to go. There are some things that we will bring to you that we would say, we really want to move this forward, or there's a meeting coming up, we want to get your input on something. So when there are items like that, we will let you know. But I do think your committee, you've probably had a couple of unique items that other committees maybe have not had. But I also think, like, you opened up the topic. You all like to discuss things, and you're not the only committee like that. And I think your discussions are really productive. I think there's also a level of engagement that we really hope all the advisory committees will bring, in terms of people really benefiting from attending and engaging in the conversation. And I don't know that we're always successful with that with some of the other advisory committees. Some people just don't discuss a lot of things at some of the meetings, and so the meetings can be a little bit shorter. So hopefully that's a helpful answer. I'm not trying to I'm just trying to be fair.
I'm just looking for data.
And I do appreciate the discussions to that end. I appreciate the discussions that we have had and the thoughtfulness with which members, all of us, have approached these topics. It's been at least for me, it's been a real learning experience being on this committee and hearing different perspectives from around the state and different perspectives from folks in different areas of practice. It's been very helpful. And we do have a couple of things that are, I think, unique to us, especially when it comes to things like psychological assessment and the postdoc. The training model that we have is very different from other professions. So that's a consideration too. Dave, were you going to say something? Did I cut you off?
I was just going to add, I try to remember to say this as frequently as I can, but I think we also have an incredible resource with the advisory committees and having experts, which I consider all of you to be experts that serve in this capacity, that we can get feedback from all of you. And so we really hope that advisory committee members are feeling like their time is valuable and that they're actively contributing and participating in different things, because I do hold it up when people ask, how does the board consider all these topics? I say, well, it's not just the 12 people, it's the 70 other people that volunteer their time serving on these advisory committees. And so I hope that advisory committee members are getting as much out of it as we are benefiting from the volunteering that you all are doing. So that's a goal. But I think I really appreciate how active you all are in these conversations and what you bring to these meetings, because it really is valuable to us. So.
So maybe this is something that we can think about over the course of the next 60 days or so, and we can return to it in our at our next meeting. And that will be on, I know it's in August. I know it's the second Tuesday in August.
Should be August 11th, I believe.
Yes, August 11th at 6 p.m. Anything else from anyone? Well, it is 7:59. I'll give you a minute back. I'll take a motion to adjourn.
So moved.
David Stevens moves. Do I have a second?
Second?
And that was that Jennifer? Okay.
Yes.
All right. Well, I think that there won't be anyone who will say no to adjourning. So it was good to see all of you. I look forward to seeing you all in a couple of months again. That is Tuesday, the 11th of August, 2026 at 6 p.m.
Thank you.
All right. Take care, everybody.